Ladies and gentlemen, this is an article that just came out in Life Science, October 6, 2017. San Diego hepatitis A issue is still spreading, everybody. They are not getting it under control. Now, over my last few videos that I did on this subject, what they did was put these hand washing machines on the street. But of course, it's not enough. They're going to have to try to find a way to clean the streets up and let these people shower. I'm serious. I think the hand washing is not enough. I mean, what's the point in hand washing if the rest of your body is completely filthy? You know, it's got to go. Or you're wearing dirty clothes because you're homeless. How do you get it under control? Hepatitis A spreads through San Diego. Why is it so hard to stop? San Diego, more than 480 people have become infected with hepatitis A over the past 10 months, and a large outbreak of the illness in California in decades. But why is it so hard to stop? About 20 new cases of hepatitis A per week have been reported during this outbreak. Dr. Eric McDonald, director of San Diego County's Epidemiology and Immunization Services branch, said at a news conference here yesterday, October 5th. Part of an infectious disease conference call, ID Week 2017, most of the hepatitis A cases have been among people who are homeless or use illegal drugs or have a close contact with those populations. Of the 481 people who have been infected, 337, 70%, have been hospitalized, and 17 have died, officials said. Dr. Monique Foster of the Center for Disease Control and Prevention's Division of Viral Hepatitis says it is not uncommon for large hepatitis A outbreaks like this to last a long time, around 1 or 2 years before they are completely halted. The downside is, these homeless people, sometimes they don't stay in the same place for a long time. So it's easy for them to branch out in other areas, and then it begins to spread in other locations in California. Though the hepatitis A virus isn't typically deadly, it can affect the liver and cause inflammation and damage to the organ, according to the National Institutes of Health. Symptoms can include dark yellow urine, fever, joint pain, nausea, and vomiting. People with the infection usually get better on their own without treatment, the NIH says, but in some cases, the infection can lead to liver failure, particularly in older adults or people who have other liver diseases. Hepatitis A spreads when small amounts of stool from an ill person contaminates objects like food or drink at another person that touches or ingests, and also sexual contact. It can spread that way as well. This can happen when people with the illness don't properly wash their hands after going to the bathroom, according to the CDC. In San Diego, officials have installed 66 portable hand washing machines in the streets to address the hygiene issue, with 100 more stations on the way. The virus can also spread among drug users, also through poor hygiene when sharing equipment related to illicit drug use, which they are doing. And this is why HIV is now spreading among drug users as well as hepatitis C. One reason specialists and doctors have a hard time stopping the spread of hepatitis A is it's a long incubation period. The time it takes a person to show symptoms after he or she is infected, which last on average 28 days, can be up to 50 days, Foster said. People infected today probably won't show symptoms for 4 weeks, Foster said. This makes it hard for people to recall what they were doing or who they had contact with at the time they were exposed to hepatitis, Foster said. And both of those factors help officials track and control outbreaks. It also means people don't yet appear sick, can infect others, causing more cases. And that's probably what's going on in San Diego right now, without a doubt. Another challenge in San Diego outbreak is the specific population at risk for contracting hepatitis A in this outbreak, people who are homeless or use illicit drugs. This is a population that has limited access to clean toilets and hand washing facilities, which are important to prevent the spread of hepatitis A. Additionally, vaccination, which I don't believe in. I don't believe in anything government wants to give you, especially if it's a free shot. With the hepatitis A vaccine is one of the key ways of prevent the infection. The CDC says, yeah, always some vaccine, which I don't trust any shots that the government gives. I just don't. It takes time to set up systems in order to deliver vaccines, McDonald said. I think those systems are now strongly in place here to address the ongoing outbreak. And then you have another issue, ladies and gentlemen, of the people even showing up for the shots. Being that homeless people move around, how do you track them down to even give them the shots if they're, a lot of times the police will run them out of a location, which means now they're infecting a whole different part of the city. In general, hepatitis A vaccine is recommended for children at age 1, which no. Okay, moving on. Prior to the San Diego outbreak, the hepatitis A vaccine was not specifically recommended for people who are homeless, but now the state of California is recommending that this vaccine be given to the homeless population. CDC officials will also consider whether this should become a national recommendation. Well, it can become one. I'm not taking no shot from no government. But ladies and gentlemen, please tell me what you think. Please leave your comment and subscribe. And if you can make a donation to my channel, please do. Peace, family.